So the pharmaceutical company Sandoz has been working with us very closely. And as Alex mentioned a little bit, 30 million doses of the hydroxychloroquine to the United States government has been given. And Bayer has donated 1 million doses of the chloroquine, which will soon be distributed to states and state health officials around the country. Teva Pharmaceuticals is also donating 6 million doses of hydroxychloroquine to U.S. hospitals, 6 million doses. So the private sector, as you'd say, Steve, it's been amazing what's happened, really amazing. And we're going to introduce you to some of the greatest business executives in the world today, no matter where you go. And they're going to say a little bit about what they're doing. And then we have so many more. The FDA has also authorized the Batil's N95 respirator mask sterilization kits. It's an incredible thing. I've been asking, why are we throwing these masks away? You look at some of these masks and they're significant pieces of equipment, and I say, how come you throw them away? Why aren't they using sterilization techniques? And I got a call from Mike DeWine, the governor of Ohio, and he's a tremendous guy, tremendous governor, and he said, we have a company named Batil, and they're having a hard time getting approval from the FDA, and I called up Dr. Hahn, and within a very short period of time, they got the approval. Steve, we really appreciate it. I want to thank Mike, and I want to thank Steve, and they're going to be able, each machine now can disinfect 120,000 masks per day. Now think of that. Each machine can disinfect 120,000 masks per day. It'll be just like a new one. It can go up to about 20 times for each mask. So each mask can go through this process 20 times. And they have 2 in Ohio, 1 in New York, and 1 will soon be shipped to Seattle, Washington, and also to Washington, D.C. So that's going to make a tremendous difference on the masks. This morning I spoke to our nation's governors to help each state get the medical supplies they need. And yesterday, Vice President Mike Pence asked our nation's hospitals to begin reporting total bed capacity, ICU bed capacity, ventilator capacity, and vital medical supply levels on a daily basis. And Mike, thank you for the great job. Thank you very much. In New York, the 2,900-bed hospital under construction, which is now completed, they completed it in 3 days, you might say 3.5 days, at the Javits Center, will be completed today, and when you look, so they're going up, I think we're going to be adding some more beds, which will be completed today, and we've opened up, and nearly 3,000 medical beds will become operational. The U.S. Navy ship Comfort also arrived today, equipped with 12 operating rooms and 1,000 hospital beds. Work has begun on additional temporary hospital sites, including a 600-bed capacity nursing home facility in Brooklyn and numerous floors of a high-rise building on Wall Street. So it's been really pretty amazing what they've done. The Army Corps of Engineers, what they've done. They just completed, think of it, a 2,900-bed hospital in New York in just about 3 days, maybe 4 days. And the whole city's talking about it. On top of that, we floated in a great ship, which is going to be 1,000 rooms, which is being used for patients outside of what we're focused on, and that will free up a lot of rooms for what we're focused on. So it's been great. The Army Corps of Engineers has awarded contracts for the construction of alternate care facilities also at the State University at Stony Brook, State University Old Westbury, and the Westchester Community Center. We're sending 60 ambulances to New York City today. We have a total of 60. We're getting some additional ones, with up to 190 more to follow at different locations. To date, FEMA has obligated more than $1.3 billion in federal support to the state of New York. So we're spending a lot of money in New York. It's a hot It's a hotbed. In addition to the 8,100 ventilators that we've already delivered over the next 48 hours, we're delivering more than 1,000. We're going 400 ventilators are going to Michigan very shortly, 300 going to New Jersey, 150 ventilators to Illinois, 150 to Louisiana, and 50 to Connecticut. FEMA and HHS already delivered 11.6 million N95 respirators, 26 million surgical masks, 5.3 million face shields, 4.4 million surgical gowns, and 22 million gloves. And I don't know if you just saw, it just came over the wires that Ford just announced just a little while ago that they will produce, along with General Electric Healthcare, 50,000 ventilators, and they're going to be doing it in less than 100 days. And top of that, we have other companies that are doing ventilators, including General Motors. But we have 9 other companies doing ventilators. As we outpace what we need, we're going to be sending them to Italy. We're going to be sending them to France. We're going to be sending them to Spain, where they have tremendous problems, and other countries as we can. But the fact that we're doing so many so quickly is a tribute to our great companies. More than 14,000 National Guard members have been activated and can help supplement state and local efforts to distribute personal protective equipment, where we're sending a lot. We have plane loads coming in. We have 51 loads from various locations all around the world, and they're landing. We had our first big cargo plane land this morning, and we're getting it from all over the world. And we're also sending things that we don't need to other parts. I just spoke to the Prime Minister of Italy, and we have additional capacity. We have additional product that we don't need. We're going to be sending approximately $100 million worth of things, of surgical and medical and hospital things to Italy. And Giuseppe was very, very happy. I will tell you that they're having a very hard time.